Okay.
Yep, you're ready.
Action! Okay. So I'm Krista. I don't know if everybody knows me, but I'm Krista. I'm the infection control nurse here at Havenwood. So this is a PowerPoint that I used last year. I did add some things, change some things, keep it up to date. I did change the end of the in-service to a little bit. I don't know if we'll be able to do it, but we'll see. Okay. So 5 basic infection control practices. Of course, 1, hand washing, hand washing, hand washing. Number 1 way to prevent transmission of infections, your best defense against any infections. Gloves, obviously, are the next best way to protect yourself. Should be worn with any contact of bodily fluids, to include blood, urine, stool, emesis, mucous membranes of the eyes, ears, nose, or mouth. You should always wear gloves when completing oral cares, doing eye drops, nose sprays, blood sugar. Some of this won't pertain to each department, but just sit and listen to the stuff that might not be for you. But everybody does need to have this information given to you. It is a requirement to give or to do an in-service on certain things. So these are the things I'm touching base on. Gowns to be worn to protect skin or clothing from spray or splashing of bodily fluids, which are bodily fluids, same thing as being listed above. Masks and eyewear to be worn to prevent exposure from spray or splashes of bodily fluids into your eyes or mouth. Not often do we have to do the eyewear. Actually, I don't know if I've ever even seen the eyewear, but hey, it's there if you need it. So, masks, obviously with MRSA we do use them. Linen and trash handling, transporting, and disposal in the manner to avoid transfer of bacteria to self, others, equipment, or your environment. My next slide kind of goes into that just a little bit more. Trash and linen should be bagged at the bedside and taken to the soiled utility. When laundry takes it out, obviously they are not gowned up right at the wing door, but when they do go back into the laundry area, you guys do have a special gown that you use to unbag all of the stuff, correct? Yes. So, please pay attention where you're putting the clothes. We have different bins that the trash goes in and the linens go in. Families always are saying, what? Mom lost the cardigan that I bought her for Christmas. It doesn't have her name on it. We go back to laundry, it's not found. Most likely, it probably got put into the wrong bin. So please just take the time when you are putting linens and stuff, make sure they're going to the right area. Okay? If linens or clothing are soiled with emesis, stool, blood, please, please, please rinse them out on the wings. If you can think of how sometimes stool smells on the wing when it happens, just think 12 hours later after it's been bagged or sitting. And it's sitting under the hopper for a whole shift. So you might add another 8 hours on top of that. The laundry does not have a hopper, so they cannot do this. So please take care of it right when it happens. Don't let things sit in the hopper if they have blood or stool or anything on them. So, that's most often when they get forgotten. So, should never be wheeling someone with a wheelchair and something that's dirty in your hands. So, the technique of one in your hand and carrying the bag, some people like to grab both hands and have that dirty laundry or garbage in their hands. Obviously, you just contaminate their wheelchair. So, unless you clean the wheelchair too, more spread of stuff, bacterias. Wise words, you want to follow these infection control guidelines when dealing with all of our residents, no matter if they have an infection or not. They might not know that they're a carrier or that they are actively infected with something. Don Olson is a perfect example. I mean, he was probably positive with MRSA like all the time. And he may not even have symptoms for days after, and then we test and he'd be positive, you know. So think of all the times we've been in contact. So just always make sure to be washing, gowning, using your proper techniques. If you always have good technique, it will decrease your chances of infections, obviously. Precautions, there's 5 types: standard, contact, droplet, airborne, and reverse. Always standard precautions are used. I list these out a little bit more. Measures should be followed with all of our residents. Hand hygiene, using gloves when appropriate, so when coming in contact with the bodily fluids, I listed them again. Discarding of sharps appropriately, proper disposal of waste, and soiled linens, and environmental cleaning. Then we have our contact precautions, which is standard precautions plus the use of gowns. So I've listed out things infections that we use contact precautions for. State actually, seeing they just left, were asking me about C. diff pretty much in depth, because C. diff is becoming a big thing, I guess, in all of the other nursing homes. I said we had 2 cases that we just tested, and they did come back negative. Of course, we do have some cases of C. diff that do come through, and MRSA are our major big ones. So, shingles, I was kind of interested to see that the CDC had shingles listed under there for contact precautions, but I think it's when it's only weeping. So when the blisters are excreting a fluid. Droplet precautions, standard precautions, plus wearing a surgical mask and eyewear. And again, I've listed out the infections that would need this precaution. These residents should have a private room also, so if something happens on the weekend, we need to try to figure out the fastest way to get them their own room. So, airborne, standard precautions plus a personal respiratory protection and special room, a negative pressure room, so they do have to go to the hospital because we cannot provide that here, so we can never care for somebody with tuberculosis or measles. So, negative pressure room has at least 6 air exchanges per hour. I know the hospital, I think, does it more than that, but that's the minimum requirement, so that's why we can't provide that. So I don't know if anyone's ever seen a negative pressure room. You have to like walk into a room and then the door closes behind you and then there's 2 doors and you gotta step into another area and do something and then step into the actual room itself. So there's a lot of steps to a negative pressure room. I've only actually seen it once. Reverse precautions, this is more to protect the patient from us. We used to have Vivian Setness up on Walnut Grove that had this when she first came in, and then she never really had it again. She had it like once or twice where you were protecting her against us. So you would wear the mask and the gloves and the hand washing when you would enter the room and leave the room because you didn't want her to get a bug. So, okay. You need to wash your hands every time we enter into these people's rooms. Okay, got that. How do we know who needs what? So there's special things that Havenwood does. This is another thing that state kind of talked to me about a little bit today. How we alert staff that they need precautions or what their special precautions are is there's a stop sign or a note on the door that says please report to nurse's station before entering, or the stop sign says I think stop, please see nurse or something. So that's one way to know that precautions are needed in that room. And then we also have a cart usually outside the room. Terry does supply us with what we need for that person and what the precautions are for that person. So if you ever need anything, he's our best guy. If not, if he's not here, then we would go get that stuff ourselves. Large garbage cans should be in the room, not outside the room. So that's another thing. It gets kind of crowded in there when you have the cart outside and the can inside and 2 people in a room, all that. So, but it should be in the room. Nursing staff and also maintenance know where these garbage cans are. So if one is not there, you can either ask somebody to get it or follow maintenance to get it and bring it back yourself. And then there's also a communicator that comes out and it tells you what they have, the date that it started on, and what precautions are needed and what it like specifically lists out what you need to do for that person. All of these communicators are given to all the departments and they should be placed at the nurses' stations. Even if that person is not on the wing, it should be hung up there. If you see these things and you don't know what it means, go ask somebody. So we will obviously want you to protect yourself and we will help you know to what you need to do to protect yourself. 3 links in the chain of infection: the infectious agent, to include microorganisms, which are found everywhere, of course. I've listed a few there. Mode of transmission: this is how the bacteria is spread. And again, I've listed those routes there. And the host, the person or object that carries the microorganisms: residents, visitors, staff, animals, and equipment. And one thing we have done to kind of stop our infection chain is we've added that little stand with the gloves or the masks and the little hand sanitizer up front. A lot of families have been commenting on that. I don't know if we're going to have that year-round or if it will just be during the flu season. I'm hoping to have it year-round because it is kind of nice for them to come and go if they feel protected. Although washing, again, is your best defense. So. Because of our residents' age and decreased immunity, they're at higher risk for developing infections, and they also don't show signs and symptoms of infections. So we might catch them later, and they might need hospitalization. Viral bloodborne pathogens, I've listed the 3 most common here: hepatitis B, C, HIV, and AIDS. They say that in the future here, we will be seeing more hepatitis C because of Vietnam veterans. Not really sure what that all includes, but just what they were in contact with would be my guess. So I haven't seen an increase, we haven't seen an increase, but they say the future will have more hepatitis C residents. On the hepatitis B vaccine, most people have already had the vaccine. It is a 3-series set. If you don't know if you've had it, you can come and ask. We have the access to the Minnesota Immunization Information Connection website, and usually they are listed on there. It's been around. Kathy, do you know how long? Somebody asked me that, and I don't know when it all started.
I don't know when it all started, but we've used it for several years now.
We have.
Yeah.
We have. So, I mean, it goes back to pretty old vaccines.
How long is the vaccine good for?
You can get a booster of it, but I don't know if they even recommend it. Otherwise, you can get tested to see your immunity to it. So that'd be something you'd have to go to your doctor for, see if you need more. A little confused today.
Well, I got it, I mean, I was at work when
Okay.
I was in contact with it.
Okay.
But I had it afterwards, but I never thought to ask if you have to have a booster.
Yeah, no,
or
once you
have
get
to
it when
have
you're a kid, you're usually completed, but you,
Oh, okay.
Yep. yeah, once you get 3, you're usually done. Hepatitis B, it's an infectious inflammatory illness that's illness of the liver that's caused by the hepatitis B virus. About 1/3 of the world population has been infected at one point, and 350 who are chronic carriers. So the virus is transmitted by exposure to infectious blood or body fluids. I listed some other risk factors there. Obviously, healthcare setting is a high risk. Dialysis is very high also, so take precautions whenever you can. Sharing razors, I wrote right there, we do not have a house razor. It was for kind of state when they come, but they didn't even look at that kind of stuff. But just know we can't use one razor from one resident to another, so. Signs and symptoms, I listed there also, and it is preventable by vaccination. Hepatitis C information, there's about 150 to 200 million people in the world that are living with hepatitis C, and they think that that number will go up. So, the disease is transmitted by blood-to-blood contact. This can be done by IV drug usage, blood transfusions, or open areas. Signs and symptoms listed there again. AIDS and HIV, I've listed what it actually all stands for. The virus itself leads to AIDS, which stands for the acquired immunodeficiency syndrome. The disease breaks down our immune system. There is no cure. So once you have HIV or AIDS, you will have it for the rest of your life. People who are infected with HIV do not have any symptoms at all for 10 years. They can, I guess, or up to 10 years or more. So I've listed some of those symptoms there. And testing is done, obviously, to figure out if you're HIV positive or do have AIDS. What do I do if? What do you do if you get stuck by a needle? Obviously, report it to your supervisor right away. And then there's a whole list of things that we have to follow for our policy of what we have to do when somebody does get stuck by a needle. There's labs for the resident who was involved, if there was a resident. The person themselves has to do lab testing right away after it happens, and then again, either at 3 or 6 months, depending upon what the doc wants from there. So please report it right away. We do keep everything on file, get your records from the hospital, what your results were, and keep them here. So, what should you do if bodily fluids splash into your mucous membranes or have contact with blood into an open area? Again, you want to report it to your supervisor. And then there's a bunch of different eye washing stations, and the MSDS book has information about what may have splashed into your mouth or eyes. Obviously find that and figure out what you need to do to help yourself from getting rashes or infections or whatever it might be. Get yourself familiar with where the eye washing stations are. I know each locked housekeeping has one. I know there's one in laundry. There's
Kitchen.
one in the kitchen,
Basement.
one in the basement. So just go and use them. I mean, they're hooked up, they're all functional. Use them, see how they work. That way, if an emergency ever does happen or somebody asks you to help them because it happened to them, you're not fumbling to figure out how it works. So faster prevention of getting those eyes washed out obviously is going to help them. Aware, I know there's a whole nother in-service about this, but they included in mine, I don't know why. Stands for a Workplace Accident and Injury Reduction Act. It's an OSHA directive. It's a safety program for Havenwood Care Center. Just gives you the right to know about what you're working with and what's in this facility, what to watch for. Again, that MSDS sheets, that's a red book that's on each of the wings. It tells you what chemicals are in there and how to react to them and how to use them properly. So if you ever have questions, that's where you go in regards to any chemicals. Housekeepers, obviously you want to be up to par with what we do with changing out detergent or sprays or whatever it might be, because you guys are most in contact with that. So, dietary concerns. Oh, hello. Hi. Food, keeping food and beverages in the employee lounge. All lunches need to be named and dated in the back lunch, like fridge. If you see something that spills over, just please pick it up. That's kind of everybody's responsibility, even if it was not you that spilled the pop or the jam or whatever it might be. One day I came in and I was going to put my lunch in the refrige. I opened it, there's this jelly just dripping, and then it was kind of flowing down the back part of it. And everybody had piled their lunch bags around the stains. I'm going, what is everybody doing? So I took time and I cleaned it up, but it was just quite funny because there was about 6 of them. They were all lined just around it.
We had open pop cans in there too. Terry opened the door one day and there was 2 cans of pop that were open, left in the door. We cleaned it
Not
up, it
smart.
was a mess.
Not smart. So, everything needs to be covered on the meal trays. If you can't find covers, please talk to Ashley, myself, Sheila, the unit managers. We will find them. If we don't know that we don't have any, then we won't be able to get more. So please say something. Gloves, when dietary staff come out of the kitchenette or the serving areas, they need to be removing your gloves and then also doing hand washing between putting on a new pair. Anytime you go into the kitchen, you should always have a hairnet on. That's kind of standard stuff. If you need help, please just ask them for assistance because all of them wear them all the time. Trays in the rooms, take out old coffee cups, bring them all the way to the dish room. Don't set them up by the nurse's station because you've contaminated that whole area now. So another thing too that people do is trays, they come and set them on tables that people are still eating. That's a big no-no, so just pay attention to that. If you were at a restaurant and your waitress came over to take your order and set down a bunch of dirty dishes, you'd kind of go, there goes your tip. So just think about that kind of stuff when you're helping the people here. Eating food, no employees are to be back in the serving area when there's food back there. Nobody should be eating our food unless we're approved, like with our Christmas parties. Activity concerns, we're not doing the candy cart anymore, so that's not really an issue, but when we were, can't go in and out, of course. Same thing with like the snack cart. Need to follow hand washing protocols in the activity room and the sanitizer between each person when you guys are doing coffee and cookies. Make sure to be following food restrictions or asking about diet texture changes on everybody if you're not sure. And nursing, of course, they have the most. Gloves need to be worn during shot administration, blood sugar checks, nasal sprays, eye drops, and none of them can be done in the hallway or the dining room. So just pay attention to that. They're not supposed to happen. Stock items should be kept, should not be kept in the rooms, excuse me, but in the nurse's cart. This does include barrier creams and wound supplies. So glucometers, they need to be disinfected with special wipes after each use. We pretty much have glucometers for all of our residents. They are set up to be washed and checked on a scheduled basis, but all of them do usually have their own. Lifts are cleaned obviously by overnight staff once a week. And then the disinfecting wipes that we do use to clean all these things, they kill a list of, I don't know, 15, 20 things, including MRSA, C. diff, that kind of stuff. So that's why we use them. They do need to be locked up. Wear gloves, because I don't know what you're allergic to, if they're gonna react to your hands. I use them all the time with no gloves and I'm fine. Other people might react to them, so I just encourage, if you don't know how you're gonna react to them, wear gloves if you're gonna use them. They were just asking about cleaning our bandage scissors. I know that was one of our tags we just got. The Cavi wipes are the best thing to clean any types of scissors that you're using with anything, so best thing there. More nursing concerns and housekeeping too, things like that. No gloves in the hallway. Oxygen tubing, when it hits the floor, just get rid of it. We get them from Northwest Respiratory. It's part of our contract. Think of how much I have a dog, and I walk in my yard, and I come in on the floor, and oxygen tubing's on the floor, now it's in Jane's nose, and, yeah, not so nice. So, just if it hits the floor, get a new one. Snack cart, cannot go into residents' rooms, I already said that, and we should be handing the stuff to them, not residents kinda attacking it. Already touched base on that one, cannot leave meds on top of the carts. Or at the bedside, lock your carts, and nursing stuff there. In the carts, we have to separate all of the different routes, so if it's a different route, it's a different container, so they do have to have a divider. They do look in our carts, state does every year, and we did good this year, so. Wipes, wipes, wipes. No wipes are to be flushed down the toilets. You hear the little down the little sewer holes, you know something's happened, and guaranteed it's Vince coming to you and saying, Marissa, there's another resident that's throwing the wipe down the toilet. Do you know who it is? We need to not have the wipes in the backs of the toilets. Thanks, Vince. Thanks. So, no wipes in the backs of the toilets. Do not flush them. Although Terry did say we're getting flushable wipes, but I think we should still follow this.
Yeah.
It seems like our sewer is weak. Hand washing should not be a task that you have to think about. It should be automatic. If I were to be watching you from the corner, I should be able to know that you are doing it accurately all the time. Just because I'm standing there, you shouldn't have to go, okay, now what? Do I get soap first or do I turn on the water first? Do I do this first? It shouldn't be that way. Make it be your normal. I know it's hard to change your habits, bad habits, change your habits. But please, if you don't know how the proper techniques of hand washing, please, there's signs everywhere. Go read them. It should be your normal. It should not be a task to do. Try to stand away from the sink. Of course, everyone's coming with their dirty hands and touching the sink and doing whatever. If you lean against it, then your clothes now might have stuff on it, and then you're going into someone else's room and making their bed, and now it's on their bed. So, just stand back if you can. Audits, we do audits all the time, here, there, everywhere. You may not know I'm watching, or you might know I'm watching, I don't know. So, good techniques all the time. Hand sanitizer versus washing. Always wash your hands when they're visibly soiled or you feel something on them. Otherwise, the hand sanitizer can be used up to 3 times. In the dining room between each tray it should be used. If you don't see a hand sanitizer bottle next to the tray serving area, please ask for one or go get one. It's not just one person's responsibility to have it, it's everybody's. So 3 times. More on that, housekeeping, when you come out of the carts, or when you come out of the rooms, you guys have them on your carts and stuff, make sure you're washing after you're in the bathroom. Of course, going from the bathroom to somebody's room is not a good thing, so washing your hands between different tasks, I should say, is always the best. Whenever we remove our gloves, 1 hand per resident for feeding. If you decide to crisscross, just remember that you're crisscrossed. So 1 hand for this lady over here and 1 hand for this guy over here. So you gotta keep them separate. Concept maps. Okay. Candace, Fawn, Julie, Linda. You guys, Candace, you're 1, Fawn, you're 2, 3, and a 4. Maybe 1, 2, 3, and you guys can go together for 4. Just have a little activity, kind of picking at your brains versus me standing up here and you're a 3. Here's just little maps. I want you guys to brainstorm what you know. You're 2. Okay, I didn't say you were 1.
She said she was a
Oh, yeah. 1, 1, 2, 2, 3, 3, 4, 4,
We want
4.
Candace with us.
You'll be fine. So I'm just gonna give you, there's different sections on here, like signs and symptoms of what's in the middle, treatment, testing, myths and facts that you might know or that you think, or if you have questions, and then how we prevent things. So one's UTI,
They're all different?
they are, one's C. diff, one's TB. So if you can go, ones can go together, 2s can go together, 3s and 4s, and just fill in the squares as best you can. I go over this every year, so it should be right there for you.
Are you and I together?
Yeah.
When was the